Assalamu alaikum wa rahmatullahi wa barakatuh. In our last lecture, we learned about cephalometric planes. Today, we will learn about cephalometric angles. Two plane lines joined together make angles. These angles are really important for sagittal analysis, vertical analysis, dental analysis, soft tissue analysis. There are plenty of analyses which I mentioned in cephalometry lecture 1. Steiner, Downs, Ricketts, Harbold, Sassoni. So there are a lot. So from all the analysis, most important common analysis angles will be shown in the upcoming slide. So the first one is SNA. We already know SN plan, we already know NA plan, NA line. So these two lines joined together makes SNA. The normal value is 82 plus minus 2. This is also depend on ethnicity. So each race they have different normal value with the different range. So if you briefly discuss the definition, SN plan joining the nasion to point A, and then it can be normal, increased, decreased. When increased, maxilla prognathic, because the point A is on the maxilla, so making the class 2 cases, and decrease maxilla retrognathic, class 3 cases. So here one example you can see 82 degree, 91 degree, 77 degree. So 82 is the average. So upper and lower jaw looks normal. And when 91, you can see the upper jaw prognathic. And 77, lower jaw prognathic. This is how we interpret SNA. Next, SNB, very easy. SN line and NB line. And this is also very important to understand the mandibular position because point B is on mandible. So in short, the normal value is 80 plus minus 2, and when it increased maxilla mandible prognathic and decreased mandible retrognathic. Moving on to the picture here, 80 degree, 77 degree, 86 degree, which clearly shows the mandibular relation with the SN plan. So mandible in relation to cranial base. So mandible normal, mandible retrognathic, mandible prognathic. Combining SNA, SNB, that is ANB, maxillomandibular relationship, you can understand NA line, NB line. So this one, if normal, it is class 1. If increase, class 2. Decrease, class 3. Moving on to width analysis. You already know the occlusal plan. From point A to occlusal plan, a perpendicular line should be drawn, and similarly from point B, a perpendicular line should be drawn. The distance from AO to BO in millimeter is width analysis. Very important to understand the lower incisor position. Sometimes A and B in angle can influence. In that case, width analysis is important. So here clearly shown the AO-BO distance. It is in millimeter, it is not angle. So this distance is the width analysis interpretation, which gives the idea about lower incisor condition. Facial angle, the normal value is 78 plus minus 2. We already know the NPOG is facial plan, and you can draw the FH plan. So this two line connecting making the facial angle. So if you see the NPOG, so mean, max, minimum, this is how it influences the mandibular position. So prognathic mandible, prominent chin, retrusive chin can be diagnosed by facial angle. This is retrognathic facial type and orthognathic facial type. If you see the end poke line, so you can understand the angle value increase, average and normal. This is prognathic facial type and this is true prognathism. You can see the when mandible is large. For vertical analysis, gonial angle is important. Articularly to gonion, gonion to menton or gnathian, this gonial angle. So it can give you the growth pattern. So the jaw is, high angle or low angle. Downward position, upward position. If downward, it gives you conclusion about open wide case, high angle case. And if it is upward, vertical growth, so deep wide case. So this is how we can use the gonial angle. Y-axis, very important to analyze the growth, facial growth. And this can be determined from SN line or FH line to Cephalometric or FH to gnathian, Y-axis. This angle also gives the growth pattern, whether vertical or horizontal growth. High mandibular plan angle or low mandibular plan angle, high y-axis angle, low y-axis angle give you the idea about the downward or vertical growth, horizontal or vertical. So this growth pattern can be identified by mandibular plan angle as well as gonial angle and y-axis. Y-axis gives the actual growth pattern. For vertical analysis, we also need to know LA-FH ratio, ANS to menton. So from ANS to menton will give you the lower interfacial height, and NA to menton, total interfacial height. Multiply with 100, it gives you the ratio, usually 45 to 55%. So it increase, decrease, giving you the idea about lower interfacial height ratio. Upper incisor to SN plan or upper incisor to palatal plan. So SN to upper incisor line, long axis of upper incisor, or palatal plan, long axis of upper incisor. It gives you the upper incisor assessment details. So when the angle increase, it shows the proclined incisor. If decrease, retroclined incisor. So here it clearly shows the details how to assess the upper incisor. Similarly, there should be lower incisor, but interincisal angle. Long axis of upper incisor, long axis of lower incisor. It makes the interincisal angle. The value is 130 to 135. And it gives idea about incisor conditions. In short, it can be ranged from 130 to 150. Average angle, the average inclination are normal. Increase angle means retruded incisor, class 2 division 2 case. Decrease angle is protruded incisor, class 1 bimaxillary protrusion, class 2 division 1 case. Lower incisor to mandibular plan also relate to the tweed analysis, IMPA, incisor mandibular plan angle. I will show you in my upcoming slide. The tweed analysis, there is a tweed, triangle triad, like a triangle. So this is giving the idea about lower incisor to mandibular plan, whether lower incisor proclined, retroclined. In my next picture, it will be more clear. Here, so lower incisor to mandibular plan, it gives the proclined incisor in relation to particular plan. If increase, if decrease, retroclined. So here it comes the tweeds, one of the important analysis. This is diagnostic facial triangle. So the values, FMA, Frankfurt mandibular angle, usually 25. IMPA, usually 90, incisor mandibular plan angle, and FMIA, Frankfurt mandibular incisor angle, usually 65. So here the details. If FMA less than 25 indicates horizontal growth pattern, more than 25 indicates vertical growth pattern. So this is the TWEET diagnostic triad. Here you can see, you can draw the mandibular plan angle with Steinert line, you can draw with FH line. Steinert SN plan is for Steiner analysis, FH plan for Downs analysis. Both are giving the growth pattern. And this is, as I mentioned, 90-degree IMPA, incisor mandibular plan angle. It can be 87, depends on race, ethnicity. So it indicates the mandibular incisor position. And IMPA, usually 65. Here it mentions 68. So it gives also the lower incisor condition. The dental analysis, upper incisor to palatal plan, FH plan, SN plan, lower incisor to mandibular plan, can be occlusal plan, and interincisal angle. All three are shown here to give you the idea about dental analysis. Soft tissue evaluation, E-line, E-plan, Ricketts E-line, or aesthetic line. Soft tissue pronasally, soft tissue pogonion, the line, and the upper lip to E-line distance, lower lip to E-line distance will give you the lip protrusion retrusion condition in relation to E-line. So upper lip 1 to 4 millimeter behind, and lower lip is 0 to 2 millimeter behind. It is also depends on race and ethnicity. It may vary with races and ethnicity. This really gives a very good conclusion about upper lip and lower lip protrusion. Nasolabial angle. A line drawn from subnasally to columella. Another line drawn from subnasally to labialis superior. This angle is nasolabial angle, usually 90 to 110. This gives idea about the acute angle, obtuse angle. So upper lip protrusion in acute angle, upper lip protrusion in obtuse angle. So when we do the analysis, Steiner, Downs, so these are the angle and distance are measured in Downs and Steiner, and then we write down the measurement value, then compare with the normal value with the standard deviation, and we present these details in a polygon. This polygon center line is the average value, and the range line are drawn from the left maximum and right maximum. Then we place our value one by one, and then draw a red line connecting all the value. Then we can understand whether the particular angle is increase or decrease. When it is placed in left side, mean minus, that is less than the average, and when right side it is more than the average. And if within the polygon, mean it is average, or within the middle line it means normal. Within the range is normal. So this is how we interpret the total result. With that, thank you very much. Happy learning. Assalamu alaikum wa rahmatullahi wa barakatuh.